Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, this show is dedicated to help you find safe and effective, safe is a big important word, safe and effective ways of treating very serious diseases and illness. Basically, for the last 35 of my 52 years, we've been doing various methods of intravenous ozone therapy to treat things. And we're going to be talking about much of what else you can do in addition to treating this serious medical problem. What we're going to talk about on this show is Alzheimer's disease. As you all know, it's a very serious progressive neurologic disorder that predominantly affects your memory and your cognitive functions. They believe it's the most common form of dementia. It gets in the way of your ability to think, remember, and even just complete daily tasks. And when we say memory, just about everything. You're not having a problem if you forget where you put your keys. You have a problem when you have your keys even in your hand and you go, what the heck are these for? That's a serious problem. Now, there's many different forms of what we call dementia. Memory issues, forgetfulness, things like that. Alzheimer's seems to come with certain symptoms that are different. And today, when you hear dementia, when you hear people having problems, they go, Alzheimer's, it's Alzheimer's. It isn't necessarily it may not only be Alzheimer's. The good news is ozone doesn't really care. It helps all of them. As I said, those are the basic symptoms of it. The real problem with it is that it impacts your daily life. You don't know where the bathroom is, and if you get to the bathroom, you're not even certain how to use it. Flushing a toilet bowl could become a problem, for example. What they found, they believe anyway, is the core is what's happened is damage has been caused in your brain, and you get a buildup of and I'm making sure if you see me looking down, I have notes here and I don't want to leave anything out that's important. You get a buildup of proteins in your brain, amyloid and tau proteins, and plaques and tangles start to occur from all this. And this disrupts the biochemical communication that takes place. And eventually it starts to spread to various regions in your brain. So it can cause all sorts of different cognitive functions and early functions, problems. So I'm not here to really tell you all the symptoms and everything of it, because it doesn't really matter. If it's any kind of brain dysfunction like Alzheimer's, we're going to be able to help. I mean, significantly help. The first goal is always stop it in its tracks. Do not let it progress. It doesn't matter how far gone a person is. You don't want it to keep going. So the first goal is always stop it in its tracks. The second goal is how much can be reversed. And that's the biggie. How much can you really reverse? Now, where ozone therapy comes in is because it's direct intravenous ozone. Ideally, you get it 5 or 6 days a week. It's a commitment. Look, Alzheimer's is a serious medical problem, and it's life-taking. It's not just life-changing. So this isn't about, I can relax and I can go away on a vacation and do all sorts of other stuff. It has to be treated in a very serious way, as one would if they know their life is at stake. And poo-pooing it or pretending that there's a lot of different answers for it, traditional medicine, as far as we can tell, has little to no real answer for Alzheimer's. Fortunately, functional medicine, as we call what we do today, seems to have major impacts, beneficial impacts on it. The direct intravenous ozone therapy is the way to go. We also can offer 10-pass if you have big, strong enough veins. You may want to listen to our podcast called Intravenous Ozone Therapy, Everything You Need to Know. I go over all the different methods, all of which we have done over time in the past, and why we use the three that we basically use, because they're the most powerful and impactful ways of helping people with intravenous ozone therapy. All these ozone therapies are not created equal, and you want to use the methods that are going to be most beneficial. And we've been doing this now at the date of this podcast when I'm doing it. This is the latter half of our 35th year, and over 425,000 intravenous treatments, more than, as far as we know, any one clinic in the world, and more, as far as we can tell, than all the doctors in all of North America collectively who do any IV method. And of course, I can use any methods I want. Nothing stops me from using a particular method. And these are the methods that we choose. The methods that we talk about on that show are the ones that we choose to use. Alzheimer's affects the way you walk. It can affect the function and use of your feet and legs. It's a very serious medical problem. There's a growing body of evidence that shows that various specific foods and dietary patterns play a role in the development of it. And you want to avoid processed foods and sugars and unhealthy fats and oils. And you want to go on a diet that's high in always organic fruits and vegetables and whole grains, lean proteins and healthy fats, always limiting saturated and trans fats, that's for sure. Mediterranean diet seems to be the way to go. Here's the biggie. Before I give you all the nutrients that may help for those of you that can add it on to the ozone therapy, you have to be well hydrated. Here's an important issue. Most seniors, as they get older, don't drink enough water or healthy liquids. Sometimes they're drinking coffee all the time to stimulate themselves, or even green teas for that matter, which do have some healthy benefits. In any case, if you're in a dehydrated state, which is very easy for seniors to get into because they want to have to run to the toilet every time they leave the house and get somewhere, particularly the women, it's a serious issue. So you have to be well hydrated. Why? Because it takes only 2 weeks to dehydrate your cerebral spinal fluid, okay, which bathes the brain and keeps the brain healthy. And it takes 6 months to rehydrate it. If you're drinking 3 to 4 liters, that's 3 to 4 quarts of purified water, healthy liquid like green juices, herbal teas, things like that, every single day. There are no days off from this. Secondly, vitamin C is essential every 2 hours while you're awake. One, it'll help you drink more water. But more importantly, vitamin C is not just a vitamin. It's necessary. It acts as much like a vitamin as a coenzyme, like you've heard of CoQ10. Well, coenzymes help in stimulating natural processes in every cell of your body, in our body. So it's very important to be taking adequate amounts of vitamin C, because if it's a high quality vitamin C and you do absorb it into your blood and get it into your cells, you're going to use what you need and within 2 hours, and then urinate the rest away. So you want to do vitamin C 5 to 6 times a day. Okay, very important. And lastly, and this is the biggie, it's called the gut-brain axis. So the gut connects to the brain. Okay, the bacteria in your gut communicate with your brain. It is known with autism and with Alzheimer's and with Parkinson's that these patients have unhealthy guts. You have to develop a healthy gut. That's where Doctor's Biome comes in. You can get Doctor's Biome. What is it? It's a very special probiotic beverage with 15 patented strains of living bacteria, living probiotics that are next generation. That means they're created to survive the stomach over 90%, and then they're called smart probiotics. They didn't go to Harvard. They actually are created to stick to the wall of your gut, which gets yeast in balance, which can cause effects on your brain. Believe it, the gut connects to everything. And if you've had antibiotics even once in your lifetime, you killed all the good boys and bad boys off in your gut. You have to replenish the good boys. Ozone kills the good boys as well as the bad boys in your gut, so it has to be replenished on a daily basis. Food and drink that we eat that also contain bad biome, bad bacteria and whatnot that our gut bacteria has to fight and kill off. So it's important to replenish them every day. Doctor's Biome is this delicious living probiotic. That means all the bacteria are alive, living in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it is delicious. Very important that you get that right away. And you could use, since you have a medical problem, I would get the medical food version of it. So you only have to take 1 2-ounce shot. It all comes in 2-ounce shots a day, and for at least the first month. Then you can go on the food supplement version of it. All right, which is a little less costly. And if you use the coupon code I'm giving to you now, all my patients use it, Howard35, you'll get 10% off the retail price, which is a nice savings. You get another 10% off if you go on auto ship. You can cancel anytime, 100% money back guarantee. You can't lose. You won't be sorry. Trust me, it's that essential for this problem. Okay. Now, in addition to taking that, if you can afford more things, there are nutrients that have been proven really beneficial. Organic coconut oil, by the way, is very good for this, along with eating a diet that's rich in antioxidants like organic berries. And don't eat any berry that isn't organic. That's for darn sure. They're loaded with pesticides and herbicides. So only organic berries. But vitamin B, B3, niacin, vitamin B12. Now, B12 you have to take by injection. You cannot absorb it orally. Hydroxycobalamin or methylcobalamin are the only 2 ways to take it. If they're going to give you an injection of the cobalamin means B12. Cyano, C-Y-A-N-O, cobalamin. Don't waste your money, time, and effort. It ain't worth the stick. It's garbage. It doesn't do any good at all. So it's either methylcobalamin or hydroxycobalamin, at least once a week. Okay? In our office, we give very powerful doses of it because it cannot harm you. Vitamin D3. Along with that, of course, you have to do vitamin K2, coenzyme Q10, L-glutamine, taurine, magnesium, NAD, omega-3, 5, and 7 fatty acids, phosphatidylcholine, serine, quercetin, zinc, ginseng, sage, berberine, gotu kola, magnolia extract, saffron. There are Bach flower remedies that are beneficial for this. These are all the things that you can do that we suggest you can add on if you can afford them all and you have room in your stomach to swallow them every day. And that's what most of the functional medicine doctors are going to put you on, is some, if not all, that I just said, because not all of them know all the things that I know. I don't practice nutritional medicine anymore. I don't study which is the best brands for all those things that I used to, that I've just recommended compared to the ones that I still use and do recommend. So I always like to work tight with a functional medicine doctor that does all the things I don't do. Okay? These are the things that you have to be doing in a consistent, careful way on a daily basis. The ozone therapy, the doctor's biome, the water, the vitamin C, and as many of these different supplements as you can possibly afford. Buy quality. If you can't afford quality, don't get it. It's a waste of time, effort, and money. Don't waste your money. Okay. We've seen some amazing results with Alzheimer's. Early onset, complete reversal. We've seen that happen over the years. Complete reversal. Stopping in its tracks seems to be a given. The key is don't dawdle. If you wait until it's too late, when things have gone way too far, you waited until it was too late. The good news is you don't know if it's too late until you try. So it's always worth a try to see what can be accomplished. And again, stopping it in its tracks, even in the latest part of the last stage of it, is still better than letting it progress and go and get worse. And again, it's not actually the ozone that's doing the repair here. It's your own stem cells. You see, ozone stimulates natural stem cell activity in your body. That's why I speak at the American Academy of Stem Cell Physicians at all their big meetings and at webinars, because ozone is just an amazing, affordable way of getting stem cells in your body to do repair for Alzheimer's, compared to doing other methods of stem cell therapy, which could be quite costly. So, and I'm not saying you shouldn't do it if you have the money. Why not try it? There's no harm. But ozone therapy is an affordable way to go, particularly the direct intravenous method and the hyperbaric high dose method, the one we call 10-pass. Those are the two ideal ways of doing it, because with the direct IV method, 10 out of 10 patients can get the therapy. And if you have a big enough, strong enough vein, that's where you can get the hyperbaric high dose method as well. And we just see all the benefits you need, increased blood flow to the brain and everything else that's going to make the difference. So everybody, if you have questions, call my office in Manhattan. Oh, please, it's very important that you join our group here, okay? And listen to all the shows that you think may be important. Take a look at some of the ones we've already put up. I switched to this channel, to YouTube and all the related ones that we're putting this up on, so you can get a lot of these shows. And you may not have a problem now, or you may have a friend that develops a problem and they can go back to the archives here and listen to the shows. So, join us, write reviews, tell your friends. We appreciate it a lot. The office in Manhattan is 212-581-0101. That's 212-581-0101. And you can email me at Ozone Doctor, OZONE-DOCTOR. Ozone Doctor, all spelled out, no abbreviations, at yahoo.com, YAHOO. Ozone Doctor at yahoo.com. Everybody, God bless you. Stay healthy, stay safe, stay well. Thank you for listening. Bye-bye now.